Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Today we want to talk about fever without source in children greater than 60 days of age. This includes young school-age children, adolescent teens, etc. Remember that these videos don't replace your visits with your physician. If you have questions, we're happy to see you here in our office for an appointment, 775-359-7111. So fever without source. If you take anything home from this discussion, what I want you to learn is this. Fever itself is not dangerous. Fever is your friend. Fever is your body's way of trying to kill whatever is making you sick. That being said, there is no degree of fever that we worry about. So I hear, for children over 60 days of age, so I hear parents all the time will tell me, we brought her to the ER because she had fever of 101. We brought her to the ER because she had a fever of 102. I know with fever of 102 you need to worry, etc. We do not worry about the degree of the fever in children over 60 days of age. And fever is defined as greater than 100.5 degrees. Temperatures of 99, 90 of 100, those are normal. Yesterday I had a patient who was complaining of fever of 98.6. That's textbook normal, okay? 100.5 is the definition of fever, 103.5, or I'm sorry, 103.5 or 103.5 is or greater is the definition of a high-grade fever, and we don't worry about fever regardless of the height. What we worry about is fever that lasts for more than 5 days. If the fever's not gone in 5 days, we want to see you in our office. The list of things that can cause this is huge and really outside of the scope of these discussions. But we want to see you in our office because we need to start ruling some of those things out. We worry about other symptoms that go with the fever. So fever and persistent vomiting. Having said that, I worry about persistent vomiting even if you don't have fever. Respiratory distress and fever, we want to see you. Of course, if you have respiratory distress without fever, we want to see you. Fever and ear pain. We can do something about your ear pain, we should see you. Not necessarily for the fever though. Ear pain without fever, we still want to see you. And that's true whether the fever is 103 or 104 or 101. Fever that does not respond to Tylenol, we don't care. Tylenol and Motrin make you feel better. They cure nothing. At most, Tylenol or Motrin will lower your fever by 2 degrees. So if your temperature is 104, or your child's temperature is 104, and you give them Motrin, 2 hours later their fever is 102, the Motrin is working. That's all you're going to get from Motrin. If the child's still uncomfortable, you can always give them a lukewarm bath. So to recap one more time, I just want to emphasize, fever is your friend. It will not hurt you. Okay? Fever does not cause brain damage. Fever does not cause seizures. Fever does not cause bad things. Okay? Fever for more than 5 days, we want to see you. Things you can do for fever, Tylenol or Motrin to help make the child more comfortable, but only if they're uncomfortable, if they can't sleep, if they're achy, if they're tossing and turning. If the Tylenol or Motrin don't work, give them a lukewarm bath. Not an ice cold bath, but a lukewarm bath, and that'll help make them more comfortable. I said that fever does not cause seizure. Some of you have seen some of my other videos and you know we've talked about fever seizures or febrile seizures. You say, wait a minute, you talked about those. The fever does not cause the seizure. Rapidly rising temperatures cause the seizure. And whether your temperature is going from 101 to 103 very rapidly, or from 99 to 100.5 very rapidly, you're just as equally prone to have a seizure. You cannot prevent these seizures by treating the fever. So giving Motrin or Tylenol at the onset of an illness does not prevent febrile seizures. Neither does alternating Tylenol and Motrin. So it's either going to happen or not happen. And they're not dangerous, and they're not something you really need to be particularly concerned about. Speaking of alternating Tylenol and Motrin, our local emergency rooms love to recommend this, but if you look at the literature that's been written in the last dozen years or so, there's been a couple of studies that show in the hospital, when alternating Tylenol and Motrin, the rates of overdose of one or both of those medicines reach unacceptable levels. And that's when you have trained professionals whose sole job is to care for the sick child on the ward today. Now we remove that child from the hospital, put them with their parent who has to cook dinner for the rest of the family, pay their bills, and try to figure out how you're going to get the other children home from school with the sick child, and remember which drug he or she gave last. The rates of overdose are unacceptably high. I recommend picking one and sticking with it. Remember, what are we treating? We're trying to make the child more comfortable. You're not curing anything with this. So alternating the drugs does nothing but complicate the medical regimen, risk overdose, and make things dangerous, but they don't cure anything. How much Tylenol, how much Motrin should you have? In children, it is weight-based, and there are instruction sheets all over the place. We have some in our office. Other people make their own. There are some that doctors get from drug companies that they hand out. They're available on the internet. Essentially, they're following the manufacturer's guidelines on the bottle. Okay, 15 milligrams per kilogram every 4 hours of Tylenol, 5 milligrams per kilogram of body weight every 8 hours for Motrin. Kilogram is roughly half of a pound. But these are the same instructions that will be printed on the bottle. Okay, our local emergency rooms are notorious for giving children 30 milligrams per kilogram of Tylenol. Please don't overdose on as a loading dose. Please don't overdose your child on Tylenol. Tylenol overdose is the #1 reason for liver failure in children in this country. So follow the recommendations on the bottle for Tylenol. For fever, follow the recommendations on the bottle for Motrin. We do sometimes give higher doses of Motrin for sprained ankles and other inflammatory diseases, but that should only be done under a doctor's guidance. I hope this has been of help, and I hope that you found this useful. More importantly, I hope we've taken away some of the fear of fevers. Fevers are nothing to be afraid of. We don't want your child uncomfortable. You do want to treat the discomfort, but that's all we need to treat. And if the fevers are gone in 3 or 4 days, you're doing okay. This is Dr. Kevin Windisch. If we can be of help, give us a call at our office at 775-359-7111. We can get you in the same day if you need to make an appointment. We'll see you next time.